Hello, this is Dr. Naidu from Cardiovascular Institute of the Shoals, and this is my first video kind of going over some of the cases that we do here in our office. The first case here that we're going to talk about is an elderly female who has been having problems walking and having pain in her legs with walking that prevent her from doing things. She previously had stents put in her arteries in her legs, and this was done in 2018, and she was subsequently told a few months ago that there was nothing else to do and that she had to live with these problems. And subsequently she came to me for a second opinion. We did an interview of her and we asked about her problems, which definitely seemed to correlate with problems associated with not getting enough blood to your lower limbs. We did ultrasounds, which again showed she had problems getting blood below her legs. The flow was very minimal. And when we did Doppler ultrasounds, we found again that her flow was minimal in her lower extremities. This led us to the conclusion that she did have significant problems. And we today did an intervention on her left leg in the office. And this is the first picture we take. We use ultrasound to get into the arteries here, and this decreases the risk of complications because the number one complication from this procedure is actually bleeding from the site where you get in. Then subsequently, we took further shots to identify where she was having problems in the blood flow down her leg. So then we put a catheter into the aorta and we look at the bifurcation here. This is your iliac bifurcation. Then we get into the other side and we put a catheter down and we start taking pictures. Here's the first picture we took. Shows you that she has a stent in here. There's flow in the stent. Further down her leg, you see there's some disease here, but there continues to be flow. Here's the flow across the knee. Again, you see it's not perfect, but there's flow across the knee. And here you see where the real problem is identified. The patient has severe disease in the blood vessels that are going down to her feet. Actually, there's three vessels that usually come off here. The anterior tibial artery you can't see. And then there is this, which is the peroneal artery, which goes down the middle of the leg, and the posterior tibial artery. This again is heavily diseased and you're unable to see it past this point. We put a wire down the vessel. This is actually a filter wire, so while we're cleaning out all this stuff, if anything goes distally, it gets caught in the filter. We actually cleaned this out with a atherectomy device and then subsequently started using a balloon to dilate the vessel back to its normal size. We did an ultrasound and we found there was disease throughout the vessel, so we dilated all these areas. And now you can see how the flow, you can see the flow's a little slow here. That's because we still have the filter, which is filled with material from our cleaning process. Now you can see that this area that had that severe lesion in it is now opened and the flow down the vessel is much better. The patient tolerated the procedure very well. We sealed her groin site, so again, reducing the risk of bleeding, and she left home in less than 2 hours after the procedure. We'll see her in 2 weeks in follow-up, and hopefully I'll give you another update then. But this is the type of work we're doing here and the type of people that we're helping. I hope you found this useful.